please contact us anytime. Yeah, but now back to you, Dr. Eva Pedersen. Thank you so much for being here. And yeah, you have the floor. There will be a Q&A session just after the talk.
Thank you very much. Let me share. Wait. Do you see the right slide?
Yes.
Fantastic. All right. Thank you all for joining. That's really great. Fine. So I'm going to talk about gender inequalities in academic career paths with a special focus on the University of Bern. So historically, the university was reserved for men, as we know. The university in Bern was founded in 1834. And the first woman to be enrolled and also graduated was in 1872. And the first person or woman who was appointed professor was in 1898. Sorry. So luckily, at some point, women started to be enrolled. And actually, if we look at data from 2022, women are doing very well. So here, this is data from Europe. So among people aged 25 to 34, almost half of the women have a university degree, while only 37% of the men have that. So while previously women were not allowed, they actually now overtook the men. However, in academia, there are still gender inequalities. This scissor represents the scissor-shaped curve, which is a metaphor for the changing proportion of men and women throughout the academic career path. And here, this is data from Switzerland and from the European Union. And it again shows this scissor-shaped curve going from left to right. And you see the green represent males and the purple represent females. You have the light colors from Switzerland and the darker colors from the European Union. So all show that at students level and also at least until PhD, women are overrepresented, but then they're gradually underrepresented the further along the academic career path you go. And this is actually quite, it's a phenomenon that exists anywhere. And it has been studied quite a lot, and there are quite some causes to this. So you can divide it, for example, into three different levels. At the individual level, there are some studies that show that job stability is particularly important to women, especially, for example, if they have family, which makes total sense. Similarly for work-life balance, so that you also have time to be at home with your family and not work all the time, which can be a problem if you really want to go for professorship, depending, of course, on the field. Then there's application rates, where it's been shown that women are less likely to apply for professorship positions, even though they could actually fit. And this follows a bit along with confidence versus job demands, that there are some studies that show that if some women don't feel that they really live up to the demands of a job, they wouldn't apply, while this is less the case for men. There are also some causes that are related to university. So, for example, hiring processes. Now more and more commissions are set up when a professorship is opening to make sure, for example, that there are equal proportion of men and women that apply, but that has long not been the case. Also, work environment at universities can be quite hostile, also at private companies, of course. Then it's been shown that often there's some unbalanced administrative workload, that women more often do teaching and administrative work, which take time away from research. And also support. Sometimes there are differences in support to men and women at university level. And since at a society level, there is still, at least in Switzerland, some classic jobs that are often associated with men, such as leadership positions, and carer jobs often are associated with women. And also at a society level is, for example, organization of childcare. So if it's difficult to get taking care of your child, it's often the woman that ends up doing this. So all of this is associated to a certain extent with this inequalities in academic careers. But if we now go into depth with the University of Bern, here you see data from the Faculty of Medicine from 2021. And again, we see this classic scissor-shaped curve. So at master's and PhD level, you see an overrepresentation of women. But at habilitation level, which is 3 to 6 years after PhD, and associate and full professor level, women are largely underrepresented. So we started thinking, so what are the reasons for this? Is this something we can actually look into? And we therefore, in collaboration with the Habilitation Commission, set up a study focused on gender bias in academic career paths at the Faculty of Medicine, University of Bern. It's a mixed method study, and we focus on this time from habilitation, just as for, if there's anybody there who don't know what habilitation is, it's another qualification, academic qualification that you get 6 to 3 years after PhD, where you need to provide, you need to teach, and you have this many publications, you have mobility, you have to have a grant. So it's really to show that you're an independent teacher and independent researcher. It is most often a requirement to get a professor position in Switzerland. So that's why it's quite an important step. We focus on this period, both because there are no studies that we found, at least, that focus on this period, and some studies in Switzerland have already looked at this postdoc period. And just to explain a bit more about professorships at the University of Bern, also other Swiss universities. But here on the left, you see this pyramid where we have the dean on top. Then there is what is called the faculty board and the faculty, which consists of tenured professors, so what is called ordentliche and außerordentliche, which in English corresponds to full professor and not full professor. And they are all employed by the university, so they are positions at the university. Then below you have the gray part, which consists of the other people at the university. So you have those who have habilitated, they're lecturers and also called Privatdozent, so PD. And among them, you have then associate professors. And these titles are all given by the habilitation office. So this means you can be a professor, so an associate professor, which is just the title, and it's not a position paid by the university. And then you have those that are paid, which are part of the faculty. So it's just that there are different types of professorships there. And before I start going into some of the results, just want to say that it's really a big project with a lot of people involved, and this could not have been done by all of these or without all of these. So the first question that we asked was, are there gender differences in career paths between habilitation and professorship? And for that, we set up a quantitative study. In October 2024, we identified 582 persons who habilitated at the Faculty of Medicine, University of Bern, since 2013. The year 2013 was chosen because since then, the habilitation office systematically registered all who habilitated. We collected different types of data. So we collected what's called registered data, or what we call registered data. For example, the year of habilitation and field of habilitation. And this we got from the habilitation office. We then also had collected public data from, for example, LinkedIn or institution websites to find out if people had reached professorship or not. And finally, we set up a survey sent to all, which asks about what happened after habilitation and all sorts of questions related to the career path. This was completed by 232, so a response rate of 40%. So first here you see the trend, the time trend in men and women who are habilitated since 2013. And what we see is that over time, the proportion of women who habilitate increases. So that is a very positive trend. We then wanted to look into, okay, how many actually reached then professorship? So here we looked into the public data, and we found that almost half of the men had reached professorship, while only 37% of the women had reached professorship. If we looked at survey data, you see here men on the left and women on the right, we see the same picture. So here 40% of the men had reached professorship, while only 31% of the women had reached professorship. So it's the same tendency that we both see in the public data and the survey data. And it also shows that there is still this inequality. It really looks like men more often than women reach professorships. And then you might say, yes, but probably this is confounded by other factors. And it might be. So we thought, okay, let's look into that. So first, we look at, again, the public data where we have information of the type of habilitation. So here, habilitation means that a person already habilitated at another university or outside Switzerland, and then you go through a fast-track process at the University of Bern. And this means that you already have spent time building up towards the professorship. So if you have habilitated, you're of course more likely to have reached professorship. And we do see that more men, at least slightly more men than women, habilitated. And secondly, if we look at years since habilitation in our sample, the men had more time since habilitation than women. So, of course, they again had more time to reach the habilitation. However, there are also other factors, as I already said, that can affect or are associated with reaching professorship. So we asked, for example, in the survey, what level of position people had. So here in the bluish colors, you see the men, and the orange colors, you see women. And we divided it into PD, the first two, and then professors, and the next two. So what we see on the left and among PDs is that men, much more often than women, work 100%. And of course, the other way around, men and women more often work 80%. And just by this, women have less time to do research. So that might already also give us a clue. We also look into mentorship and work breaks, and we see that men more often reported having had a mentor than women. However, luckily, the difference is not that big. And if we then look at work breaks, and here we asked, have you had a work break of more than 2 months? Women, at least among the Privatdozenten, so those who habilitated, were 3 times more likely to have had a work break. And the reason was most often due to caring for children. We also asked about discrimination in the survey. And here we also see quite striking data that women, both among PDs and also among professors, more often reported discrimination than men. The reasons among the women, that's most often gender or sex, while most often the causes among the men are lack of expertise or the feeling of discrimination because of expertise or personal situation. We also asked about harassment in the survey, and here we see that the oral harassment, again, was reported more often among women, both among the PDs and the professors, as well as physical harassment, also reported more often among the women who were PDs. So this is, of course, quite a bad sign. We also asked about household chores, which is again and again mentioned in this inequality discussion. I know this slide is quite busy, but it shows different types of chores. So going from shopping, food preparation, gardening, household maintenance. You see the different colors. Green is that the household chores is primarily me who takes care of it. Orange is equal share, and the blue is someone else in the household. If we look at food preparation, for example, a household chore that is often at least associated with women. We also see here that first you have the PD men, PD women, professor men, and professor women. And here it is more often the women who say, yes, this is primarily me. Another example of, let's say, classic household chores that are associated with women is emotional labor and childcare. And also here we very often see that the women say that it's primarily them who are responsible for this. Of course, there is also some chores that are classically associated with women, such as house maintenance. And here it is also the men who say, yes, this is primarily me. So we do see still some of these classic roles in the households, although, of course, there are also a lot of places where it's shared, equal share, but there are still some classic patterns to say. We then did a regression analysis where we put professor, yes, no, with all the professors in one group together versus not professor, to see if gender is associated with becoming professor or reaching professorship. And indeed it is, after even adjusting for years since habilitation, which was very associated, as well as habilitation, we see that women still have lower odds of reaching professorships than men. So what about those who then are at the university? Do they intend to stay? And here we asked them, and you see the dark green is those who plan to stay, and you have the orange, those who plan to leave, and those that are unsure. And you might think, okay, if women are less likely to reach professorship, maybe they also don't really want to stay, but that doesn't seem to be the case. So at least among the PDs, women more often than men reported that they plan to stay in academia. So that's very interesting. The reasons for being unsure or wanting to leave there are quite some different ones. Administrative burden, which was too high, was mentioned. Clinical position doesn't allow enough time for research. There was high pressure, financial restrictions, discrimination, bad work climate, and then too few permanent positions. So this last one came up again and again, that the prospects of reaching the academic career goal was too difficult, and therefore many were unsure or wanting to leave. And how many then actually left? So among those who were reported to be currently employed in the survey, 6% of the men and 6% of the women had left academia. Most had gone to another university or cantonal hospital, just not in an academic position. Some had gone to a private practice or private hospital, and there are some that went to the administration or private foundation. But here, interestingly, at least, we don't see that men more often than women left. But of course, this is also the survey data. It's difficult to say among those that we couldn't survey. Right. So just to summarize what we found in this survey and the public data, we do see a time trend that there are more women that habilitate. So the pool of people to choose gets bigger and bigger, which is great. However, there are still fewer women than men that reach professorship. And there's still some of these factors that clearly differ between men and women, such as work breaks, childcare, mental load, and discrimination, which might still affect this association. Our next question was what barriers and facilitators people experience and whether there are differences in gender differences. And for that, we set up a qualitative study. We did 18 interviews between February and September this year. Among these, 61% were women. And we had a good representation of different career stages. So yeah, 1/3 were PDs or not yet professors. 1/3 were associate or assistant professors. We had some full professors, and then we also reached one outside academia. We would have liked to have one more or several more, but they were actually quite difficult to reach. Yes, we did some preliminary analysis already, and we saw already some quite interesting things in the data. So, for example, if you looked at academic goal, we see a bit this two different types. So some already had professorship as an original goal. So, for example, one said, my goal was always to get as far as possible, as high as possible, to really had this professorship in mind from the beginning. And then there were these where the professor goal developed gradually. So, for example, it wasn't that I woke up as a little child and said, I want to be a professor. I just really enjoy research, and that was my passion. And that's why I pursue an academic career. So to be able to continue doing research and choosing what research to do, these people wanted to reach the professorship to be able to stay. Then we looked at motivation, and here it's quite interesting because they all have this intrinsic motivation. So this passion for discovering new things, being curious, being part of this, discovery. That's really mentioned by almost all, that they enjoy the research so much that they really just want to continue and stay. Barriers and facilitators. Barriers, we saw both structural and personal barriers. So, for example, this structure or the criteria for reaching professorship. So one, for example, if you want to do an academic career, you have to apply for professorships around the world, but that did not fit with my private life. So this balance between what is needed for the professorship and the personal life. One mentioned that the bosses or the department were very supportive, which is, of course, also a big barrier towards the academic career. For the facilitators, they often mention, for example, mentorship, but also personal relationships, so that they had the support from home, which is super important for reaching the academic career, because, of course, we also spend a lot of time at home with our families. We then also asked people, so what do you think is the reason that fewer women reach professorship? And here we had quite a lot of different comments. So one talks about that there are quite few role models for women, and so quite few actually reach the top, and sometimes they have to be quite hard to actually reach it, and maybe a lot of people then actually don't necessarily see that as role models, which can then be a problem. One mentioned that there are these small things, for example, women are less pushy, or they're more satisfied with where they are. And then there was a man who reported an experience where he had gone to a conference with his woman boss, and the boss gave a talk and then said, yes, and this is my postdoc. He's doing good research, and then he's an excellent dancer. And he felt that it was really strange, this comment on something that wasn't on his research in this super full research room. And he then thought, okay, yeah, maybe this is how it is for many women that are often where other things than their research are mentioned, what they say, how they look. But actually this comment, we had a discussion recently, and it was really there were quite some discussion, because, okay, does this mean that we are just taking things too personally, or is it just silly, or can people then not talk about anything else than your research, because it's about your person? But I still think that this happens more often for women than men. But I still think it's important to discuss these things. So the full analysis are being done. But the preliminary results show that everyone has a different experience, and everybody also has clear experiences of gender bias in academic careers. So then you might ask, okay, but is nothing being done in Switzerland? And yes, there is actually quite a lot of initiatives. I'm just mentioning a few here. So for example, here in Bern, there is what is called the COMET mentoring program, which is aimed at women early in the career. There was also recently, for example, in the Uni Aktuell, so the newsletter from the university, a whole booklet focused on women in science, so really also putting focus on this and the problem. Also, the Swiss National Science Foundation, there are quite some initiatives. So they have initiated, for example, different gender inequality analysis in Switzerland. They also have certain grant schemes, particularly for women, so the flexibility grant. And then the Swiss universities also organized together, for example, the HIT program, which is a leadership training program for women in academia. So there are many different things, but of course, it's quite a huge problem. So it takes a lot of different efforts to improve. There are also other studies ongoing in Switzerland. We've recently been part of a network, so both at the University of Zurich, University of Basel, and University of St. Gallen, there are studies going on. But it's still actually quite few when you compare, for example, to other countries. In the United States, there are tons of these studies. So it's at least good that there are some studies out there. And then how does Switzerland then compare to Europe? To find this out, we did a systematic review. And this is currently ongoing, among others, Maya, and of course, Dani is working on this. It aims to systematically review the gender distribution across academic career stages in different European countries. We're currently at the full text screening and data extraction stage. There are 2 independent reviewers doing this. We already double screened 230 out of 311 reports. And so far, actually, we've included 111 studies. So that's actually quite a lot. It's a bit more than I expected, but that's really great. Yeah, we hope to have this paper drafted in January. And maybe here a bit before I stop, just so why do we even care about these gender inequalities? Of course, it's important for the fairness that men and women have the equal opportunities. But if you look at the literature, there really also seem to be many more advantages of gender equality. So there are studies that show that with increasing gender equality, the economies improve. So it leads to higher employment rates, leads to higher gross domestic product. It also shows that, for example, leadership teams with equal proportion of men and women make better decisions. There are also studies that it shows a reduction in social inequalities, and there are many more points. So it's not just in academia, and it's not just at the universities. It's really within the whole society that it's important, and we can really profit from it in many different ways. So to sum up, there is still gender inequalities, and it's still important to look at the causes. And there also seems to be some progress, which is great. We do see that there are more women, for example, that habilitate and go for the academic career, but the progress is quite slow. There are very good ongoing initiatives, but it's really important that we keep the focus and keep writing about it, keep doing studies, because we need some exposure, I think, also to improve it. And then there needs to be a shift in culture on all different levels. So, of course, individually, maybe some of us women need to try and go for it and be brave and go for the professorship. The universities can still do more, and especially in society. At Switzerland, for example, it's very important, for example, to improve childcare opportunities so that it doesn't need to be the women who stay at home. So with that, I'd like to say thanks so much and for listening. And yeah, I'm happy to discuss any questions. I just listed a few of the Swiss studies here.
Yeah, thank you very much, Eva Pedersen. This was very, very interesting and so important, the topic. It's great talk. Thank you. So I would just start with the first question, and then I ask the audience. So did you look as well on like salary gaps or other conditions, like maybe that can also be a reason to?
Yes, we didn't ask about salary. No, unfortunately not.
Or like how many postdocs you can, or like all the like the whole package. I mean, there are differences
But
probably.
I think that is, I think that's a really important question as well. I think it's a bit difficult in Switzerland. Often we're not so keen to talk about salaries, but I think that would be very important. But this data might, I don't know, be possible to get from the university human resource. And actually, maybe we could. It might even be more reliable to get it from there. I don't know. I remember that we discussed whether to put it in the questionnaire, but it was already so long probably that we decided not to put it. But yes, one thing that I didn't say, we also looked at who had protected research time, for example. And there we saw actually that women more often than men had protected research time, which was a bit was a bit curious actually. Yeah.
Okay, thank you. Then in the chat can you elaborate on the discussions you had about evaluation of scientific métier versus more personal characteristic? From Karen Ambrosen.
Not sure I completely understand what the question. So,
Karen, are you here?
whether a person is chosen. Hi.
Yeah, it was just that you said you had some discussions. There was this man who was a good dancer. So you had some discussions about this weighting of scientific métier up against more personal characteristics. And I was wondering, first I was wondering, okay, why would that be wrong to have to look at personal characteristics? And I think that I wondered, maybe there are some personal characteristics that are used against women, but not against men. And I was wondering, what were your discussions about this?
Yes. So it was actually this thing that so first we thought, or I at least had this impression, yes, I think, and I think also studies have shown this, that women more often get, let's say, comments on their person or how they look or what they wear than men. And yes, is that then a problem? But on the other hand, if it's so much more often among the women, why can't we just in a research context talk a bit more about that? It also shows, actually, I saw a study in student evaluations that women much more often get comments on what they wear in teachings than men. So I think it is something that we could maybe discuss, and but it is quite difficult because, like, if we cannot talk about anything else or personal characteristics, it's just that it seems unbalanced. But how to deal with it is really a bit good question, or if you should deal with it. But on the other hand, like, why is there then this difference? Yeah. But I'm happy for anybody else actually to give an input on this. Yeah.
We have Florina in the audience, and then Max.
Yes, thank you, Eva, very much for this interesting talk on this very important topic. If I understand correctly, you were more in detail looking into the survey respondents, or you asked survey respondents that already habilitated were private docents or professors and full professors. And I was wondering why you didn't already start like earlier in the process, so asking also PhD or postdoc people or researchers about their academic path, because I think that this is quite an important step for your academic career. And as we saw in your graphs of this scissor-shaped curve, I think there it's really deciding in which direction you're going. And I think that the pressure already starts quite early in your academic career.
Yes. Well, ideally, I think it would have been great if we could have started, let's say, already at PhD level. But the problem was, well, first it was a collaboration with the Habilitation Commission, so those who give the titles, the Privatdozent titles. So they had the list, and it's always easier to go from a list than to try to find people somewhere. So that it was, to a certain extent, a feasibility question. But actually, there is there is a medical MD thesis student who's working on this project. She asked both medical students and resident doctors. So that's, of course, not just academia, but there are also studies going on this. So it's not that it's not done at all. But yes, for this particular project, it was a feasibility question. We didn't have a good way to directly contact the PhDs and the postdocs.
Thank you. Max?
I had a question regarding one of the graphs, which I thought was kind of interesting with the rate of discrimination and harassment. Is there any, or maybe could you comment on the potential that the more you speak up or speak up about harassment or discrimination, that this might actually severely negatively impact your chances of an academic career and lead to maybe kind of a silence culture?
Yeah, I think that's probably quite likely. We did have some comments in also the questionnaire where some people had actually spoken up and had the feeling that they were pushed out. So I do think that this exists. Luckily, at least from what we saw in the questionnaire, it wasn't that common, luckily. But I do think it exists. I think it's extremely difficult to really investigate because often, maybe people don't want to speak up. But there are some of these instances, and we also heard some experiences from people, and I do think it's a problem. But and I think it would be important to look further into this.
So we have, thank you, one question from Eben Trebak about the role of professional career guidance. It's in the chat. Or maybe even, are you here?
So
yes,
hello.
I'm on my way from this meeting to my next, so that's why I thought I was going to write my
so much better to answer the question like one-to-one as in the chat.
But I just wanted to ask if that was a part of your survey questions. Did you ask about the access that these early career researchers had to professional guidance, career guidance?
Yep. So we did ask if they had a mentor, and we did define it quite broadly. So whoever they could think of as a mentor, and we also actually asked about organized mentoring programs. What I didn't show is that most of the women actually all who had participated in an organized mentoring program were women. So even though they had often had a mentor or what they defined as a mentor, they actually more often than the men had participated in some of these organized mentoring programs. So I think that's really actually really great because it shows that some of the initiatives that are done people also make use of were the women. But more particularly, guidance, we didn't ask, but we did ask about these programs.
So, and Sharon?
Hi. Can you hear me okay?
Yes.
Thanks so much. That was super interesting. And I know we've had some chats about this project, but I was just wondering, in terms of your recommendations, because how to bring this forward is so critical, or what types of interventions, either at a system level or institutional level. Did you find any kind of publications? You mentioned in the States, there's a lot of research going on in this, of what interventions or what we can see to actually improve this in the future.
Yeah. So it's really, there is really a lot. But I did actually find one intervention study where they randomized, I think, by departments, and then they tried to give extra focus and extra guidance for women, and then see if more got promoted over a certain period of time. That particular project, I don't think it showed any effect, actually. But I also think it's really difficult, because the thing is, I think these things go quite slow. And in many universities, there are relatively few professors positions getting open. So you need either super big study with lots of departments, or over really long time. And for many project groups, this is just not feasible. So I think we still need to think, how can we further analyze this or investigate this feasibly to find out what interventions work. Of course, there are ecological studies, so we can look at, or cohorts, and look at, what changes over time. But the actual randomized interventions there, I didn't find that many, but there might be some out there that some other people know. We're very happy to hear them in case. Right.
Thanks a lot.
Yeah, thank you, everyone. Is there a last question? Otherwise, I thank you so much, Eva. It was a wonderful talk, and keep on.
Thank you for listening.
Thank you. Bye, everyone.
Bye.